And I can't tell you how thrilled I am tonight to share with you our collaboration and our partnerships with Quarry, Quincy Asian Resources, with Carolina Sarayed Robeiro-Dim, and also with Symone Seidewand. And we also have Jill Carras, who's a special education team administrator here with us. We have translation available for this webinar. So if you go to the bottom of the screen, there's a picture of a globe and you can switch on for translation. We have Cantonese, Mandarin. The Cantonese is unfortunately under Japanese because we can only have one selection for Chinese. We have Spanish and Portuguese available for translation. So thank you to the translators that are here tonight with us. So we are so fortunate to have the partnerships that you're going to hear about tonight. I am just going to do a little bit of an overview so people understand how we got this collaboration and these partnerships within our schools. So I'm going to just do that quickly. And then I really want you to meet Carolina and Symone because they are really outstanding. It's really an honor to be working with them this year. I'll go to the next slide and I just will talk about the first partnership we have. So with Quincy Public Schools has a long history of collaborating with our community service agencies, and one of them is Aspire Health. Aspire Health is a mental health agency that provides many services to our community and surrounding communities. They've been around for years and years, I think about 70 years, maybe longer. And they have a whole hub of services. Two of the directors, Janice Sullivan and Kristen Woodbury, reached out to me before the start of the school year and said, hey, we have an opportunity for a clinician, to be fully funded, through us. They had a generous donor and they had priorities that they'd like to see about supporting families and students with mental health. And they offered us a full-time clinician at no cost to the district. And that happens to be Symone. So we, met a few times to talk about the priorities of the grant, what that would look like, how that would best benefit and support and lift up our students at North Quincy High School and Quincy High School. And I think we've really done a great job implementing that service to families. And I'm not going to speak too much about what that looks like because I'm going to leave that to Symone. Symone's going to share that with you. So that's how we were able to have Symone in both of our high schools. And now I'm just going to talk a little bit on the next slide. I'll show you the behavioral health navigation slide. So Beth Israel Leahy Health put out an RFP, which is just a fancy way of saying that they put out a grant opportunity. And they did it for 3 communities, and Quincy being one of them. And it wasn't specifically for schools, but it was for social service agencies, mental health clinics to have, or health clinics to have a behavioral health navigator. And I really felt like having a behavioral health navigator within our schools was a great opportunity because I know that we have wonderful partners and agencies, but there's often waiting lists. It's a very complicated way to navigate, health insurance for behavioral health. It's hard to know what's available, what types of services are available. And the grant really spoke to me because it wanted to reach those folks that had the most barriers to accessing mental health services and supports. So I wrote the grant and luckily we got it, and it is, really fantastic to have this 3-year grant. And that's how we were able to hire Carolina. And we did that through Quincy Asian Resources because I wanted an agency that had experience in hiring, multicultural staff, counselors and mentors. And so I used Quincy Asian Resources because of their roots in the community. And Carolina happened to be working in our schools already. She was a family liaison through Quincy Public Schools and has done like outstanding work in that role. So she was a natural selection. So working with Quarry and Carolina, we were able to have Carolina join, Quincy Public Schools as our behavioral health navigator. And we haven't looked back, and we're so excited that, the three of us are working together with the whole district and families, and it's been really an amazing experience. So we want to share that with families and community members. So if you go to the next slide, it just kind of talks about, the impact, the impact we hope to have is to support evidence-based and informed strategies and programs, build community cohesion and capacity, and work towards systemic, fair, and just treatment for all. So we all feel like mental health and wellness is a right. It is civil right for everyone. It takes a team and it takes a community to have mental health and wellness. And, we're so fortunate to work with the students and the families in this community. And everybody has been working together to make sure that kids are getting what they need and families are supported in the way that they deserve to be supported. And the next slide is for Carolina. So I'm going to hand over the presentation to Carolina, and she's going to talk to you about her work. Thank you so much.
Hello, everyone. It's a pleasure to be here today, and thank you all for your time. And I cannot express how much I'm grateful for this opportunity to be in this role. I'm really, really grateful for that, and to be able to help so many families and students, and to work together with so great people, staff, and I have tons of good words to say. But let's go to our presentation today. And in my presentation today, I want to explain the behavioral health navigator's role, how it's integrated to the school culture, how we support students' mental health, and talk also about our partnership with our community partners. So first, I thought that it would be important to talk a little bit about what behavioral health is. So according to the definition, behavioral health refers to a state of mental health, emotion, and social well-being or behaviors and actions that affects wellness. And what are the topics that are under behavioral health? So we have mental health challenges, we have thoughts or actions related to self-injury, difficulties with substance use or addiction related to challenges. So those and also there are different aspects that impacts the mental health, and sometimes we are not fully aware of these aspects, and some of them are social challenges such as bullying, lack of emotional support, low self-esteem, lack of basic needs, not having enough food or not having housing, lack of access to health care, financial hardship, deal with conditions such as depression, anxiety, and ongoing treatments, dealing with traumas, abuse, violence, and social isolation, which includes here language barriers. Sometimes it makes it difficult to socialize. So I just want to emphasize here the importance of addressing behavioral health and all factors that impact mental health and our overall well-being. And if we apply the importance of mental health in the school setting, we can say that behavioral health is about helping students to succeed by supporting their mental health, emotional, and social well-being, and also building skills that can help students to manage stress, emotions, solve problems, and develop a really healthy relationship at home, in school, in other settings. So now, what is the role of the behavioral health navigator? So is a committed, and I'm completely committed to this role. Is a committed professional funded by a grant from the district, working to bridge the gap, to connect students, families, and behavioral service. Also, in my role involves a hands-on and comprehensive holistic support for students and families, mental health, and by helping them to navigate challenges and access the necessary rights resources. So now, what are the major responsibilities of the behavioral health navigator? So one of them is access and identification. So that means that recognizing particular challenges and needs of the students and also their families that requires attention to support their mental health and well-being. Referral service. So the referral service, we connect the students and families to agencies that offer service primarily related to behavioral health. For referral service, after talking to families and the students and counselors, we do our best to align the needs with their needs with the service we offer. So when doing the referral, we consider aspects such as the type of the therapy that the parents are seeking for the children, or for example, the home-based, the family therapy, individual therapy, or school-based therapy. The agent's location, the access to language and cultural support, and also the type of health insurance acceptable. So these considerations help to ensure that referrals are appropriated and meet the family and the student's needs. I just want to add one thing that I have been experienced, that sometimes we should be mindful that due to the volume of the referrals, sometimes that agents receive, sometimes it's not possible to schedule, like, for example, the individual therapy right away. However, and because these requests sometimes is placed on a waiting list, as Ms. Mora mentioned. However, we are here to help, so we are here to follow up on those referrals on the waiting list to make sure that we try to speed up the process as much as we can. Another point for the responsibility is like the support for the families, which implies understanding families' unique circumstance and also cultural challenges. So providing to families by connecting them not only with mental health resources, which also very, very important, but also with other essential services, such as access to food pantries, assistance with health insurance and childcare, help with employment, and sometimes even connecting them to agencies that provide English classes, because some parents really want to learn English to pursue better opportunities. And the last point, not least, collaboration with the school staff. So this point, I have to say that I cannot talk about my role without acknowledging the invaluable and essential contributions of the school staff. So one of the key aspects of my job is the collaboration with guidance counselors, principals, assistant principals, student support service directors, school-based clinicians, and other school staffs whose teamwork is vital for my role. Our collaborative work enables us to provide the best support possible to students and families. And I'm truly grateful to work with such dedicated and compassionate team that genuinely cares about the students and families. And last point and not least, this is the last one, is the crisis intervention, which provide immediate support to students during crisis, such as thought of harming themselves or harming others. And we rely on the support of agency partners that work with us, as well as school-based clinicians. And Symone from Aspire. So integrating behavioral health at school. So what are the ways that behavioral health is integrated in our school culture? So first is building a supportive and inclusive school environment where mental health is validated and prioritized. And one of the ways to achieve that is by fostering open communication, customizing our supports to meet the unique needs of families and students, such as recognizing that families come from different backgrounds and need language support, and being mindful of their cultural background. Also, offering a behavioral health support by reducing the stigma and making discussions about mental health more approachable. So some families may come from backgrounds, beliefs, or culture where mental health is not fully acknowledged or validated, and they can create that can create barriers for seeking for help. So it's very important to respectfully address this barrier by explaining what behavioral health is, the role of the professionals in the field, and the potential consequence of not addressing health issues. And also the last two important points that I would say is supporting staff to recognize behavioral health concern and responding appropriately, and also encourage early intervention to prevent development of more serious mental health issues. So now, how can we support students' mental health? One aspect should be following or checking in with students and their parents or guardians regarding their social emotional concerns, creating a welcoming and supportive place that encourages students to seek for help. And we can achieve that by building a very good trust with students and also their parents, and establish a connection. Assessing student progress and making adjustments to intervention as needed, and in partnership with Quincy Public Schools Wellness Coalition, facilitate group workshops on topics such as stress management, coping skills, and emotional regulation. I just want to add that the Quincy Public Schools Wellness Coalition is an initiative by the Quincy Public Schools in partnership with great agency partners to enhance mental health support and promote a holistic approach to student well-being. And now, what are the goals of the Behavioral Health Navigator program? So we have here supporting students in boosting their emotional, behavioral, and mental health, increase parents' participation in supporting their children's emotional well-being. A parent support is also a very, very important factor in helping the students to meet their mental health needs. Also, having a positive school environment, and that means that this helps to reduce behavioral health problems and school absence related to mental health challenges. And when addressing those challenges, it can lead to fewer issues in behavior and less time missed in school. And also, when the students receive the mental health support, they are more prepared to cope with their emotional and psychological struggles. And the last point is to better access to service. And that means like increase and facilitate inclusive access for students and families to connect to mental health. And for that, we count on our partners, community partners agencies that offers amazing service and support. When I mention inclusive in that sentence, I mean that making counseling accessible for all, including service with clinicians who speak also different languages such as Mandarin, Cantonese, and Portuguese, and others, and also using language tools to facilitate the communication. So now I would like to talk about our partnerships and community resources. So we count on our valuable external collaboration, our local community partners such as Quari, Quincy Asian Resources, Aspire Health Alliance, Bay State Community Service, Maria Droz Counseling, Walker's Therapeutic, Quincy Family Resources, and Big Brother and Big Sisters to provide the service that all our students and families need and deserve. So here, sometimes families are unaware about some great service available for them. So that's why it's important for them to learn about the mental health resources and other relevant service that offered by the community, and to have assistance in accessing these resources when needed. And also support beyond the school day. So assisting our students on ongoing care outside the school time. Some agents have flexible schedules to accommodate after school appointment during the week, and also some might have also provided some weekend service. So I'm extremely happy to be able to help so many families in different ways and in different needs. and to count with the support of a very great school staff and also great community agency. With our collaboration is just making the life of our students and families much, much better. So now, talking about our community partners, I would like to pass over to our amazing partner, Symone from Aspire Alliance.
Thank you, Carolina. So my name's Symone. It's nice to chat with all of you tonight. Thank you for taking the time. I think this is a super important topic that we are addressing. And kind of like Carolina was saying, I think some families don't know what resources that the school can help provide. And I think it's really important that we chat about that. And Carolina has been so fabulous to work with. It's so nice being an outside provider and having our connection. And I think we work well together and we work on different cases in different ways. And it's really nice to put our heads together with different topics and figuring out like how we can best help the family and what resources would be most helpful. So with that being said, I'm from Aspire Health Alliance. I started with Quincy Public Schools in July. And so it's been a great resource. Like Maura was saying, our grant started then, and we've been figuring out the best way to use it. And so I am stationed at both Quincy High and North Quincy High 5 days a week, which is awesome. And if you go to the next slide. So just a little about Aspire Health Alliance. We do have a lot of resources available for families. I am one of the school-based clinicians. There's only one as of right now in Quincy, so that would be me. We have a few other schools. We offer outpatient counseling, in-home therapy, therapeutic mentors, trauma services, crisis stabilization units, and DBT programs for teens as well. But more so a little about our school-based services. So I'm in the schools 5 days a week, and through the grant funding, it's free for families, for students to meet with me for some ongoing emotional, mental health, behavioral support, which is really, really awesome. I think that's really helpful because, as Carolina has mentioned, all of the organizations that we partner with, that we try to refer to, sometimes we run into long wait lists. So that is super hard and frustrating when we're just trying to do the best we can for our kiddos and get them the help that they need and that they're seeking and asking for, which is the first step, which is amazing and awesome that they're doing that. So my role, I do see a lot of students for short-term brief therapy, and we do that through the grant. So it doesn't go through health insurance. It's free for families. And if we go to the next slide, here are some of the school-based services, which are similar to Carolina's in a way. I also provide counseling for our students at both Quincy High and North Quincy High, and I help bridge the gap for some students who are on wait lists to outside counseling. And I can make those referrals as well as Carolina can to some more intensive services that they might need, some in-home family services, a big brother, big sister program. So we work with the students and figure out what service would be best for them. I also collaborate with the school staff. That's how I get most of my referrals. So they might have a student that might need just a little more check-ins than the regular, like, how's your class going? What's going on? So I collaborate with school staff on what services might be appropriate, how we can get the student the best help that they need. But most importantly, my role is focused on crisis and crisis intervention and assessment. So I'm a school-based crisis clinician by title, but I do all the counseling and I'm help bridge that gap. But similar to what Carolina was saying, if students are ever feeling unsafe, if they feel like they want to hurt themselves or others, we can do an on-site crisis evaluation. So that looks like, with me, we would go through an evaluation and determine safety and risk and level of care needed and what the next steps would be. And that is a great, great, great resource, because before, students would have to have been sent out to get an evaluation, maybe at the hospital. And when students are in crisis like that, there's a lot going on, and going to the hospital could heighten their crisis that they're experiencing, or could make matters worse. So the fact that now we can do crisis intervention within the school is absolutely wonderful, because it makes students almost feel a little more comfortable, and they can get seen in school that day on site crisis evaluation. I can do safety planning, and that is something that is huge, because within the scope of school counselors, they are not able to safety plan like fully. That is not the scope of their practice. So it is really, really beneficial for students. And I have done a number of crisis evaluations already this year, and I've seen a number of students for individual therapy too. So the need is definitely there, and I am very, very honored to be sitting in this role and working in this role and helping students get these resources that they need and that they're seeking. The next slide. Well, and that was that. Oh, before I do say, the crisis evaluations, unfortunately, are not through grant funded. So those do go through some health insurance, but with Mass Health, most of those are screened out. So Mass Health is typically when you would not receive a bill for a crisis evaluation. That is something that is important to note for families, because some evaluations do go through insurance. But most that might have Mass Health are likely not to receive a bill.
Great. Thank you so much, Symone. Although, this is like a webinar format, so if you would like to ask some questions, we'll take some questions in the chat. So you can use that. I do want to say that this is going to be recorded, just so you're aware. And we will be posting this presentation on our website. So we'd be glad to take questions. And I actually see a question right here, so I will gladly read the questions from the chat. Is this service for high school students or all age? So the behavioral health navigation services, that was Carolina who presented for us, is for the whole district. So she is running around and making calls and taking referrals from every single school within the district. And Carolina's role really is to make sure that, we understand like what's happening from the counselors, like if a student is struggling with social interactions or is looking for a therapeutic mentor, that's important for Carolina to reach out to the counselors who would like to get the family some services, figure out like what's going on, and then reach out to the family. So that's available for everybody. At Symone is just at North Quincy and Quincy High School. And she's only one person, although I would like to clone her and have her in every single school. We're just not able to do that. Is it only the school that consult, or can the parents? So that's a really good question. So that's we do have contact information. Actually, if we want to go to the next slide, the contact information is there for Symone if you have a high school student, and Carolina will speak to you gladly and see if she can help you, and you can reach her through her line. Do we need to take an appointment, or how can we reach out for the service? So you can reach out anytime. There is like school hours, they do have like a schedule, so it's not like, and if you have like a mental health emergency, you would need to, call Aspire Health and go for a crisis evaluation. That's if it's really escalated. So if you were concerned about, suicide, someone hurting themselves or somebody else, then you would use that phone number. And we can actually put that phone number maybe in the chat. I don't know if it's Symone, if you wouldn't mind doing that, or I can do that. Before we end, I'll put that crisis number in, but you certainly can, leave a message, email at any time, and Carolina and Symone will reach out to you. So I don't see any other questions at the moment, but I will give it a minute. Is there anything you wanted to add, Symone or Carolina?
I'm just pulling up the number right now.
I think it's 617-774-6036.
6036, yeah. I'm just trying. Oh, my chat went away. Yeah.
That's okay, I got it. Thank you.
And if any family, they want to reach out, so please, you can call me. I have the phone over there, or email me, and I will, like, as soon as I can, I will reply, and we will talk for sure. I'm happy to help.
So I have another question. So my son is placed out of district. Would you ever work with his school or family in helping with a wait list? And of course, you know, if your child is placed out of district through Quincy Public Schools, you know, Carolina would be glad to respond and
For sure.
see how we can help.
Mm-hmm.
And then it says, my son is on a wait list for a DBT and it will be a year or longer.
Mm.
So, you know, sometimes when we have a situation when there's a specific service that might not be available, it seems like the ideal service. Sometimes we recommend, rather than wait that long, maybe it might be good to have a home-based team, you know, so like, you know, maybe thinking a little bit outside of the box, so that there are like what they call IHTs, that's like a home-based family therapy. So like, you know, maybe take the service, maybe it's not the exact service, but sometimes just having that connection. And if the connection is really good between the student and the clinician, that goes such a long way. You know, maybe take a chance and maybe go with something different. If you can't get the exact service you need, as long as you get some kind of support. And there's a very long question in maybe, it looks like Spanish. Is that Spanish or Portuguese? I think that's Spanish. I don't know, I can't, I'm so sorry, I can't read that. I don't know if the translator can maybe read that question in the chat if they can see it. So somebody who asked the question about whether the service was for high school students, Symone from Aspire is a crisis clinician for Quincy High and North Quincy High School only. And Carolina is the Behavioral Health Navigator for anybody at any school. So if you are looking to find services, Carolina can help you no matter what school you're at.
Mm-hmm. And Ms. Mora, and I just want to add, like, if a family does not speak English or Portuguese, which is my native language, we count on the language line. So this is not an issue for us. You can reach out and we can call the language line and we can speak. So this will not be like a barrier for you to reaching out to us. We have those great, amazing tools that enable us to communicate. So feel free, any language, feel free to talk to us, that we will be able to have a great chat.
Yep, and someone made a comment in the chat. This is very helpful just in case there is a crisis at the school, and that is very true. Symone has really helped us. You know, we don't want to really send kids out to be seen when they're in the middle of a crisis. And we always have to do that if we didn't have a crisis clinician. And now that Symone is in the building, you know, like Symone had talked about the safety planning and things like that. So, you know, that's a good thing because sometimes, you know, students have to go to the emergency room to be seen or to the clinic on Quincy Ave to be seen, which is okay. It's just, I feel like it's a little more stressful, you know, for families to have to go to like an emergency room and sometimes you wait for hours. We don't want that experience. We want kids to be able to access the support they need in the most helpful and gentle way possible. So we are so grateful that Symone is able to kind of do that work right in the building. And we don't do that unless we have parent permission. So we're always partnering with parents, you know, like what is it we can do to help you? We're in this together. This is your child. And we're always very, very respectful to make sure that we're working together in the best interest of your child, because we just want to make sure that you get the help that, that you need. And I think Symone's presence has really normalized the fact that, like, it's okay, just like kids are, I think, really comfortable going to their school counselors. Like, sometimes you need a little help. And that's what we're here for, is to, provide that surround care, to make sure that we're a soft place for your child to land, for you to land when you're dealing with something difficult, because stuff does happen. And, we're not perfect, we need each other, we're always like working together and trying to problem solve and trying to support. So we're so happy to have the opportunity, and it's an honor to be able to do that with students and families. So we appreciate you so much.
Yes, it has been truly wonderful. And I can attest to that because maybe like 1/4 or maybe 1/2 of the students I've seen have never reached out for help before. So it is wonderful that a lot of them are finally doing that and feel comfortable to do that in school, which is awesome.
Yeah, I mean, that is a testament to who Symone is as a clinician and as a person, as so that is really true. And Carolina could not, I can't tell you how many principals and counselors have said, oh, I don't know what we did before Carolina. She sticks to it until it gets done, and sometimes it's hard to do that, so she's a great advocate. So, whatever it is, whether it's a food pantry, whether, we're keeping a list of all the interventions and all the things that Carolina is doing, and it's incredible how much help there is for families.
Thank you so much, Ms. Moore. And it's really interesting that since I start this role, I realize that, as I mentioned, like in my first slide, that the behavioral health. So, how many things impacts like mental health, and sometimes we speak to families, and it's just about getting a counselor or getting a support for the mental health. But when we fully discuss about things and we open up, I realize that sometimes there are other needs that also impact the mental health of the whole family. Some even is about the food or some experience that they are having at home. So I'm very fortunate that we have this whole group that is genuinely supporting our families and students. So I feel very awarded to be part of the team that doing this great positive change in our community.
Yeah, and I do want to say that QPS, the Quincy Public School Coalition for Mental Health and Wellness, is new this year. It's not new that we collaborate, partner with all our agencies, but we kind of did that in a way that was siloed. So it's really great that we get together.
Ms. Moore, I think that you are mute.
Openings and what the resources are. And Jill Karanis. Oh, is my speaker not working?
It cut
I'm
out
getting a
for
message
1
that my speaker's
second.
not working.
Yeah.
We can hear you now. We lost
Yeah.
you for a couple sentences, but you're back.
Sorry, can you hear me okay? Oh, you can, I'm sorry. Okay, I was just getting a weird message. So I just want to say that Jill Karanis, who's the special education team administrator, works closely with our social emotional programs. And she's part of that QPS coalition, and she's been a great addition, connecting special education with social emotional wellness. And so we're glad to have Jill here with us tonight. She's a great partner too. So within the district, you have, the counselors, the school adjustment counselors, the health interventionists, and the supervisors of attendance. Because the supervisors of attendance, they're doing really, really important work for those kids that are having difficulty attending school because of social emotional reasons. There's usually something else happening for a kid if they're not attending school. It's not that they're just defiant. We don't believe that. And families are doing the best they can, but we need to do an intervention to get kids back into school if they're having difficulty attending school, because that's the healthiest place that they can be. So it takes a lot of different kinds of people, a lot of different kinds of interventions, and moving forward, we will do another presentation in February. We'll have Carolina come and Quincy Asian Resources present. So Carolina, again, will explain her role, and we will highlight Quincy Asian Resources in February. So that's February 4th. It will be this same format. So, you know, if you talk to people and they missed this presentation, there will be another presentation, and we will invite Quincy Asian Resources. We do have a little bit of a survey at the end. If you don't mind taking the survey through the link or through the QR code, you know, that would be fantastic for us. We'd like some feedback. We want to make sure that we're getting the information that you need and spreading awareness about our services. So that feedback would be great for us. And I don't know, I don't see any more questions in the chat. I don't know if anybody else from the panel has anything else to say.
The only thing, Mara, was that if that one
Oh,
question
sorry,
was
we
in
can't
there-
hear you, Jill.
Can you hear me now?
Yeah, so, you
Oh,
can
they
hear her? Okay.
I can put it in the chat, Mara. I was just going to say, I'm not sure if there was a question in Spanish in the chat that we were able to have someone translate, or I'll put that in the chat, Mara.
I'm so sorry. I could not hear Jill. Did you just say something, Jill? And okay, just a comment.
Can you hear me, Laura?
I can hear you now. Yep.
She just asked, she wasn't sure if that question that was in Spanish or in the chat got answered or if it was a comment.
I couldn't read it, and I didn't
Yeah.
have any help with translation. So
Yeah.
I apologize.
I have a question.
Sure.
I'm a new father, and I was wondering what are like the main things mental health wise to implement at home in order for kids to grow up properly. I have two daughters. I have a 5-year-old and a 2-month-old.
Oh, wow. You are a new father. That's exciting. Congratulations on your family.
Thank you.
No problem. No problem. You know, I think that like, you know, having community and having like a healthy relationship with like daycare and school and things like that is always a good place to start, you know, like those healthy relationships and being connected is really, really helpful. I think that parenting, you know, is so challenging, and you know, no one's an expert like at the beginning. So like if you ever thought about, you know, you could definitely connect with Carolina if you thought about, you know, just supporting your parenting skills. You know, they're at Quincy Family Resources, I know, which is on
Yeah.
Hancock Street. They run parenting groups all the time, parenting support
Mhm.
groups.
Okay.
You know, that's like a resource available to you. But I think, you know, in general, you know, just really kind of being connected to like how your child's learning in school, what are their relationship, you know, just kind of being, you know, like curious and informed about your child's development.
Right.
And, you know, working with the school is really helpful. Your kids are really little. So I think like school is a great place to start, just to like, you know, those pro-social skills,
Right.
you know, and partnering with the school. That's what I would recommend.
Wow. I mean, you hit it around the nail. I'm a college student myself, and I used to teach at Massasoit Community College. I used to teach physics while I was a student there. So I'm big on
Wow.
education. So even at home, I'll have her name is Alila. I'll have her do homework. I'll have her even do homework with the television on. I was talking about this with my soon-to-be wife. That in nowadays people are faster, so she should be able to do homework while something in the background is playing. But you hit around the nail, focusing on education. I use it as a social thing, and you also said staying connected with my community. Um, Thank you. That was really helpful. That was really helpful.
Oh, thank you so much. Thanks for being here.
For sure. Thank you for inviting me. I just saw the email. I don't even know how I got the email. So I just said, let me join. And I joined. And yeah, we're having a conversation. And it was right in line with the things that I want to grow in and understand. So I stayed. I'm actually here with my wife, Brittany. And we're just following. And then we had opportunity to ask questions. So we chimed in.
Nice. I appreciate that. I think you're not alone. Like, I feel like people really need to be connected, to be healthy. You know, like your relationships kind of impact like the quality of your life. So, you know, if you can, you know, feel good about, you know, your community and your neighbors and your kids' friends. And I just think that those things are really, really helpful. And teachers are really good about social emotional learning and support. And when kids are really small, they do a lot of that teaching, you know, within the classroom. So I just think like staying, you know, informed, you know, what's happening in class.
For sure. Thank you. Thank
Thank
you.
you.
Mhm. You have a good night.
Thank you. You too.
Thank
Does
you.
anybody else have any questions before we go? Hey, I just want to thank everybody for being here. Thank you so much to the parents and, you know, to our presenters. And I hope everybody has a good night and feel free to reach out if we can help.
Thank you so much,
Thank
everyone.
you.
Thank you.
Bye-bye.